Hi, I'm Zeta from DG Health. I host the Women in Health Tech series that I've been running since last year. And today I'm joined by Veronica Devlin, who is currently the Chief Transformation Officer over at Manchester Foundation Trust. So they're doing a hell of a lot of things over there at the moment. I mean, Veronica, could you give me a bit of a snippet into what you're currently doing over at MFT at the moment?
So the transformation team at the minute are supporting quite a lot of the work around COVID recovery. So standing back up our elective activity for surgery, implementing new models of care for outpatient departments, such as virtual clinics. And we're also supporting some of the work around emergency care because the emergency care demand is increasing back to sort of normal levels. So we have to accommodate all of that work, which is quite challenging at the minute.
Yeah, no, definitely. Especially as we deal with sort of that post-COVID world and what that's going to look like for some of the pathways as well. It's really crucial time. But you have a very, very interesting background as well, not the most conventional. So you're medically trained as a GP. How have you actually ended up in a transformation role like this?
So I started out as a GP and then went into emergency medicine and was an emergency medicine doctor for over 20 years and got involved in improvement as part of that role. So looking at how we changed how emergency departments worked, and it was back around 2005, 2006 when the 4-hour target came in, and I got involved in a lot of the improvement work around that. And got the bug for it, I think. And my career started to diverge. I took some time and spent 5 years working in the private sector as well in management consulting. So I've really been doing improvement and transformation in one form or another for 15, 16 years now.
Yeah, it's interesting, especially going from obviously that GP background, and MFT are definitely pioneering, I think, with what you're doing over at the moment with the EPR EPIC program and really bringing like midwives and people from that clinical background into the program. I mean, I think we're really going to see that cultural change happen a lot faster, I guess, in terms of that user adoption piece as well, which I know some trusts really do fall down on. So yeah, I think it's good that they've obviously got somebody like yourself who's obviously been in their shoes leading the way as well. And it's interesting because we've obviously spoken quite a bit about some of what's happened in your life. I guess if you had to do it all again, what would you sort of do differently?
I think believe in my own value more, and I think I probably undervalued my skills, my transferable skills from medicine. So I think when people train in medicine, they think that's the only thing that they can do. Yeah. But actually, there are lots of transferable skills in medical training, so you can be very useful in a lot of different environments. And I think I learned when I went into the private sector that actually my skills were very marketable and very sought after. So I think it's about looking up and looking at the broader picture to see what skills you have and what value you can add to another industry or another piece of work, and not being limited by what people's perceptions of you are. I think you just have to think, if you can do it, I think I can do that job, I'll give it a go and maybe take that risk.
Yeah, definitely. I guess in terms of that, because obviously you've been across the board in terms of like different sectors as well, and I'm guessing there's going to be some obstacles you've faced. What would you say, could you just go into some detail about some of the key obstacles or pushbacks that you've potentially faced and how you've overcome them as well?
Yeah, so I think some of that, the barriers you have to overcome can be about people's perception of what it is what you're capable of. So it's a bit like that. You're in the mold. You're a doctor, and therefore you can only do a certain thing, and you have to be able to persuade people that actually you're capable of doing something that's slightly not what they would expect from what your qualifications might be, and being willing to step out of your comfort zone and try some of that stuff. Prove to yourself that you can do it and prove to other people that you can do it, but also be prepared to fail, because you have to. That's how you learn. You get something wrong, you won't do it again the same way. So I think there still is quite a lot of sort of stereotypes around medical careers, and you know, what you're allowed to do if you're a clinician versus a manager. And I think I have faced some employers where there's been a degree of inequality in terms of how men are treated versus how women are treated. That was very obvious in the private sector, and that actually surprised me a bit. So although it's you know, after Me Too and all the rest of it, we think things are moving on. Sometimes it feels a bit like 2 steps forward, 1 step back.
Yeah, it's interesting because I think especially in the last few years, there's a lot to be done with like companies getting boards together to make sure like the ethics there, diversity and inclusion. But obviously, I think we are still not where it needs to be. So it's interesting because there's so much out there at the moment, but it's what are each company doing. But when we've spoken, I know when we've spoken, it's interesting when you've got a good leader that's sort of spearing you on and fighting in your corner, then you tend to get by a bit better. What's your sort of take on that?
So I think the best people to work for are people who recognise you for all your strengths and all your flaws, and are willing to support you where you're probably not so strong, and who will invest a bit of time and effort in developing that part of you. And I think particularly in healthcare, where we're so fast paced, although it might not seem like it from the outside, it's that can be quite difficult, but it's really, really important to actually set aside that time to work with your teams and develop your teams. And I think the best bosses I've had have been the ones where they really get to know you as a person, and they understand your family circumstances, and what you bring to work every day isn't just the brain, you know, it's your heart and soul and all of the rest of that. So they're interested in looking after that and interested in you as a person and willing to help develop you to be the best that you can be, because ultimately everybody succeeds if we're all being our best selves. Everybody succeeds.
Yeah, no, definitely. Playing on your strengths is just going to be so key, because obviously programs are going to succeed if you really play to your strengths. So no, I love that. And you've already touched on this at the moment, but what would you say has changed for the better for women in the workplace over your time, and what do you think needs some more work? Because you've obviously done a hell of a lot in your career.
I've been around a long time. So I started in the NHS 34 years this August.
Wow.
And in those days, as a junior doctor, we weren't even allowed to wear trousers on a ward round. So So that's changed. The working conditions have changed. So obviously doctors' hours have changed significantly, and a lot of how we deliver healthcare and how patients are engaged with that healthcare is slowly changing. I think there is still that stereotype that if you train as a doctor, that's what you do. I think there are a lot of the younger docs who are coming through now who all of them have got a side hustle. They're all doing something else outside, you know. So they're developing an app, or they're setting up their own company or whatever. So I think that's slowly starting to change. I think people have definitely got much more of a perspective on work-life balance as well. So, you know, when I started out, first week when I qualified, I worked 104 hours in my first week. So people find that hard to believe, but that has changed. So so we no longer make people do that anymore, which is good. So I think the things for me in terms of delivery of healthcare that have changed significantly is that we are patients are more of a participant in their healthcare than they were before. Right. It used to be, you know, doctor knew best, and you went to the doctor and the doctor gave you instructions and you went off and you did it, and that wasn't a relationship that worked. So it is much better now. There's still a lot of work to be done on that, and so that patients can really fully engage. So some of the stuff we're doing with our electronic patient recorder is around giving patients more control digitally over how they make their appointments, how they interact with the teams who are looking after them, how they access the information that's held on them as well. And so much has changed in the information sphere, even in the last 5 years. Things are moving very, very quickly, and COVID has driven a lot of that actually. So we switched really rapidly to virtual outpatient clinics, and we're able to manage patients at home without them having to come unnecessarily into a hospital environment during all of that. And that showed us really how quickly we can move when we need to move. I think the challenge for us is to maintain that pace, because you know, our customers, our patients need us to adapt as quickly as the rest of the world is adapting, and historically the NHS has not been as good at adapting as it might have been. So I think we've learned a lot. Although it's been, you know, it's hugely difficult and tragic for a lot of our patients and families and our staff. We have learned a lot about how we make it better and how we can do it more quickly and more effectively.
Yeah, no, it's really interesting, because I think as well with when I've been doing these events, especially during COVID, a lot of doctors, clinicians were quite skeptical of using like digital health apps to support them. However, during COVID, there's been the most amount procured and pushed through, and it's really interesting, like the amount of things being pushed out across like pediatrics and different things to how do we engage with children that can't come into the hospital, how do we engage with patients. And now I think some trusts are taking it one step further by rolling out like wearable technologies, especially like cardiovascular, heart, etc. So that's going to be really interesting, I think, in terms of like a next step. So I'm interested to see what's going to happen with those sort of specialized trusts as well, and see how much they capitalize on this digital agenda.
Yeah, I mean, it's hugely exciting. I mean, even looking at how families and clinical teams can help look after older adults with dementia, for instance. So using technology in their homes to make sure that they're safe and that they're not having falls, etc., that they're eating and drinking at the right time, all of that kind of stuff. So it's moving, not just, so we've got all the well-being stuff that's going on around, you know, fitness apps and all the rest of it. Yeah. But the opportunities really are pretty limitless, and it's a really exciting time because there's so many of these prototypes out there, and some of them will take off and others will, you know, it's adapt or die with these things. So they'll either keep up with the speed of development or they'll disappear. But I think the next 10 years, I think we'll see an explosion in how much of that care that we give can be enabled digitally. So it's not just about records, it's not just about how we contact patients, it's actually about how we do care, how we monitor people, how we pick up on disease before it's evident by using some of this technology. And all of the stuff that's going on with AI in so labs and radiology, really, really exciting. So if you've got reliable algorithms that can help you detect disease more quickly, that's really going to improve cancer outcomes and makes a massive difference to patients' lives at quite a big scale. So this is a really, really exciting time to be working in medicine, in healthcare, and in tech, I think.
Yeah, 100%. I think I liked the point that you just made about sort of like the elderly, because I'm really interested, and I do a lot of reading about, you know, incorporating like the Alexa into the homes and monitoring and sensor. And I think if we manage to get that right, which I know potentially might be quite costly, but I do think it really helps. And in terms of like their mental health as well, just having someone additional to talk to, and also will save so much time, especially to the community nurses, because I feel like they just do so much anyway, because they have to be here, there and everywhere. So yeah, that's one to watch for me anyway. But no, I have to check up on that radiology stuff, because yeah, I've been reading into it, but I don't know as much as that. So no, that was great. And I guess in terms of this, because you mentioned before 34 years this year in healthcare, so big tenure there. What were some of you've obviously looked at technology now. Anything you wish that you had back when you were sort of starting out or through your clinical days, like some of your favorite pieces of tech that you're seeing now and you're like, gosh, that would have made my life so much easier back then?
Well, when I started out, we didn't have any computers to do anything with, so it was all paper. So pretty much all of it is like, when I started out and did my first emergency medicine job, everyone was recorded in a massive paper ledger, and that was the record that we had for the hospital. And you had a card where you wrote all the notes, and so there was a lot of physical filing and all of that stuff. So I think for me, now that we're about to implement our electronic patient record, that it would have blown my mind if I'd had access to it then, but that in itself is such a massive leap forward. It sounds as though it's just an administrative process, but actually there are massive patient safety benefits in having electronically held records. It means that there's a single version of the truth for that patient, and everyone can access it. So you don't no longer have to worry about turning up to an outpatient clinic and having no case records for the patient. So you have to start from scratch again, and all of that stuff. I think some of the lab technology as well is amazing. The turnaround time is fantastic, and likewise with radiology interventions that we've got. So I think it's hard to put a finger on one thing. It's just so it is, the working environment is just so totally different to what it was when I started.
Yeah, I think what you mentioned before about it'll be interesting to see what happens in these next 10 years as well, in terms of like how far can the interoperability actually go. So that'll be really, really interesting to see if we can get some shared data across all the filters through the NHS. So that'll be really one to watch. But Noah, you've got a big program on your hands as well, very well known in the sector. So I think everybody is eagerly anticipating how that goes across the scale. So yeah, great stuff going on with the trust. And I guess just as a final note, what's some of the best leadership advice you've ever been given that you could potentially share?
The best advice I ever got was from one of my bosses, and he said, hire people who are brighter than you and who are good at the stuff that you're not good at, and look after them. So basically, it's about diversity in teams. So there's no point in recruiting 5 people who are all exactly the same as you, because you'll only be good at one thing. So it's about finding people with different perspectives and different skills, different backgrounds, different outlooks. And that's really what makes a team work.
Yeah.
It's not about everybody coming to work and agreeing on everything. And it is about having a bit of constructive debate and knowing that you're safe to have a bit of constructive debate. It's okay to disagree. You find a way forward, and you work together as a team. So for me, it's about focusing on building a team, because nobody does any of this on their own. And to get the right team, you have to look for the right sets of skills and look for where the gaps are, and try and recruit according to what skills you need, as opposed to who's available or who you like, because it's not always about finding a kind of personal relationship.
Yeah.
Sometimes a bit of itch in a team can be quite helpful. There's somebody that's a bit challenging a lot of the time. It can really drive people forward. So yeah, I think that's the best advice I've ever had.
Yeah, it's quite interesting because we're seeing more and more of that come out at the moment, hire diversely. The most successful teams, I believe, across like IBM, Microsoft, AWS, they're all really diverse teams from different schools of thought, etc. They all club together, challenge each other on a daily basis, every sprint, stand up. It's really interesting, and I think we do it a lot as well in our sort of hiring strategies internally. We hire based on diverseness, so it's really good. It's really interesting to see. But yeah, I know you've got some.
They're better fun teams to work in, though, because people have the more different perspectives you've got, the more interesting it is.
Yeah, because you're never going to learn off somebody if they already know everything that you do anyway. So, yeah, I think it's good to bring in out of the box thinkers that, will challenge you. So, no, that's really, really good advice. But no, I've really enjoyed this. Getting to know you, and I'm excited to sort of share your message as well. And yeah, like I said, I think people will be eagerly anticipating how your program goes, what's going on across transformation over at MFT as well. So yeah, big plans on the agenda for you guys. So I wish you all the success, because I know it's going to be really challenging. But thank you so much, Veronica, for joining me.
Thank you. It was lovely talking to you.
Thank you. Yeah, I'll have a couple of more of these coming up over the summer as well, before my big event in September. So I look forward to seeing you all again soon. Thank you.